Hey, Bob. Glad you can make it.
Hey, thank you.
So,
Great to be here, Lucas. Are you all set?
yeah, totally fine. Anything you want me to touch on? Anything in particular?
Just act naturally. You have to sell the drug, but it has to be believable, or else we lose the whole documentary image.
Not a problem. Not a problem. The drug's gonna be a huge hit here. Should I disclose my my affiliation with the company? For legal reasons.
No, not at all. You'd only have to do that if you had stock in the company. Our arrangement is more discreet than that.
Perfect. Let's get started. Great. So, should I look at this camera or should I look at this one, like her, or?
Just look here, yeah.
Perfect. Great. Okay. Should I start?
Whenever you're ready.
Perfect. Hi, my name is Dr. Foreman. I am the attending physician at Welfare Dermatology Clinic. I've been the attending here for almost 3 years now.
Great. Could you tell us a little bit more about what you see and treat here at the clinic?
Yeah, absolutely. Obviously, we treat all kinds of conditions related to the skin, but far beyond any other condition, we treat acne the most, and that is why I'm so excited to be offering Floresta for the first time at our clinic.
Great. Can you tell us a little bit more about Floresta?
Of course, yes. Floresta is a super exciting new drug to treat acne. As I said, acne is the number one condition we treat here. It is a once-a-day pill that's promising to show amazing results in some patients. In fact, patient interaction with doctors and fluorescent action are some of the things I was hoping to capture today by inviting you and your film crew to follow us around.
Awesome. We're excited to be here today. Thank you.
Great.
Hello, I'm Dr. Danbury. I'm a resident here at the Welfare Dermatology Clinic. We're partnering today with Xanoderm Alpha Pharmaceuticals to be offering Floresta to help people that need it the most. Dr. Foreman is an excellent physician, and I think he is going to be the perfect physician to be offering this drug. His patients love him.
Hi, I'm Lily Thomas. I'm a fourth-year medical student on my dermatology rotation here at Welfare Dermatology Clinic, and I'm working with Dr. Foreman. I'm hoping to go into dermatology for my residency next year. This will be my second week here, and I've really
Wonderful. I'm very sorry. Dr. Foreman mentioned something about Floresta. Could you talk a little bit more about what that is?
Well, to be honest, I don't have much experience with Floresta. I haven't really read that many studies that have shown any efficacy or really anything in human patients. There might have been a rat study, but I can't remember.
Okay, sure, but that's probably just due to you being new to dermatology as a med student.
I guess it could be, perhaps.
Great, okay, great. Lily, you're doing great. But you are really here to give Floresta a good image. Just smile, say some supporting words, and we'll head to the patient room. That's all you need to do.
All right, but did Dr. Foreman okay this?
Of course, we would absolutely not be doing this without his support.
Okay. So apparently Floresta is a brand new oral medication taken once a day, which will completely clear skin. Although patient use so far has not been scientifically documented or shown to be significant, perhaps Dr. Foreman's trial will surprise us.
Well, I hope that went well for you. I have no idea what to say.
Me neither. I wouldn't really know about Floresta anyways.
Yeah, I just tried to say a whole bunch of great things about Floresta and Dr. Foreman.
Seriously, I tried to stay as neutral as possible, but I'm not really sure if everything you said was true.
Hey team, how's it going? Hope you're as excited as I am. I'm just want to touch base real quick. The film crew's here. They're not trying to disturb us in any way. They're just here to show how we interact with our patients normally, everyday life, and see Floresta in action. Really, Xanoderm has been really good to the clinic. I'd hate to disappoint them. Sound good?
Yeah, we want everything to go smoothly, Dr. Foreman.
Great.
Sure.
Yeah, great. Glad you're pumped. Glad you're on board. Let's go. Okay. Dr. Danbury, is your medicine ready to give us a quick summary of the patient in this room?
Lily, you got this?
Yes. The patient in room 325 is a 24-year-old Asian male named Mr. Asano. He's presenting to us today with a history of persistent stubborn acne for the past 7 years. He has had some betterings of his acne with the use of ointments containing benzoyl peroxide, but he's just moved to the area and joined our clinic and wants a consult for a continuation of care.
Great. He sounds like a perfect candidate for Floresta.
Mr. Asano has been getting very frustrated with his persistent acne, and he's been very discouraged at the lack of efficacy of the topical creams that he's tried. So perhaps Floresta will be a good alternative.
Come in.
Hello, Mr. Asano.
Oh, hey, what's up?
My name is Dr. Foreman. I'm the attending physician here at the clinic. I know you've already spoken to Dr. Danbury, but I just wanted to come and talk to you personally. How are you doing?
Pretty good, but what's up with the camera?
Oh, don't mind the camera. The camera's just here to film us giving care to patients and for us to give better care to patients. It's really filming me more than it's you, so just pretend the camera's not in there.
Okay, if you say so.
Great. You really have nothing to worry about. In fact, we have some pretty exciting news. I know how burdensome topical creams can be, applying them every day.
No, it's been fine.
And so we're actually going to start you on a brand new drug. It's super exciting. It's a once-a-day pill, and it's shown to be just as effective, if not more effective, than your topical cream.
I don't know. I mean, the cream has been working just fine for a few years now. Are you sure?
Trust me, this new drug, Floresta, will really change how you think about taking care of your skin.
I really think this pill is going to make your life way better, way more convenient than the creams.
I mean, if you think it'll help.
Perfect, yeah. While Dr. Danbury finishes up here, he'll grab you the prescription and get you started on the consent form, and we'll just be outside if you need anything.
Here, Dr. Foreman switched from the standard of care, which is a topical ointment. However, Floresta is really next generation medication. So we're hoping to see excellent results with Mr. Asano.
Yeah, and like I was saying, I think this is a great option for you, especially if you're going to college, and acne is a huge issue in college. I know that you haven't had this issue in the past, but we really want to nip in the bud before it starts, especially when we don't know when the next time you'll be here. Sound good? Great. I'm going to send someone in to fill out the consent form. I'm going to go run and grab you your prescription. Don't move.
Was that the patient in 440?
Yeah, what's up?
Wasn't she just in for a skin flip biopsy?
Yeah, no, I know she hasn't had acne in the past, but I was just thinking, Floresta is great. It can be used as a prophylaxis, so might as well just take it now. She doesn't have to come back.
Okay.
Yeah, so she's a great patient for it.
Okay.
Are you good with finishing the consent form? I'm going to go around and get the prescription.
Sure.
Great, okay.
Miss Kane?
Yes?
Hello again.
Hi, call me Josie.
Hi, Josie. I'm just here to talk to you and discuss your thoughts about starting treatment with Floresta.
Okay, well, I didn't come in today thinking about starting a medication. I didn't know my skin was prone to breakouts. Is Floresta something you normally prescribe to people who aren't having problems with their skin?
Well, in all honesty, I'm a fourth-year med student, so I'm not a doctor yet, like Dr. Foreman or Dr. Danbury by any means. But I don't feel it's right to not disclose all the facts to you, to allow you to make your own informed decision about your healthcare. Floresta is a really experimental drug. It's completely new in clinical use, really. What's going on right now is a clinical trial that's being spearheaded by Dr. Foreman and a pharmaceutical company. So there really hasn't been any efficacy shown in human patients just because of that. Right? In previous studies in the lab, they've shown that it sort of equates with spot treatments, so topical skincare. Have you used any of those?
I've used Clean and Clear and Aveeno in the past. I've always just purchased them at CVS.
Okay, and looking at your skin right now, it doesn't seem like there's anything going on specific, so do you still use those to help your skin or no?
No, not really. I stopped after middle school and I quit the junk food eating habit. So
Okay.
My skin got a lot better.
That makes sense. So seeing as your skin looks great, pretty clear, and you're not using those right now to maintain that, I would feel really hesitant about sending you out and telling you to go buy one of those at CVS or over the counter anywhere. So if I wasn't going to have you use one of those, I wouldn't prescribe to you medication.
Okay.
That being said, if you really feel like you would like it, Dr. Foreman would be happy to prescribe it to you. I can tell you that. But I personally would not take it if I were in your shoes. I feel that you don't need it, and I'm sort of worried about other effects because it is an oral pill. You take it and it will go through your GI tract. So there might be systemic effects, which are sort of effects that happen in your body. And we don't know the risks because there have been few human patients taking the drug. So I feel like you might be putting yourself at risks that we don't really know about. So I wouldn't advise it.
Okay, yeah. So given that it's an experimental drug, I think I'm going to wait, and if I have any problems, I'll probably just go back to using Clean and Clear or Aveeno. But I really appreciate the honesty. It makes me feel a lot better. But I think I'm going to hold off on the rest of it today.
I'm glad you got to make your own decision, and I feel really good about you having all the facts and being able to decide what's best for you. That being said, if you do discover in a few weeks your skin's gotten worse and you have a breakout, feel free to come back in.
Okay.
We can have this conversation again and reassess things. And there might be new information out on the drug. But yeah, as for that, I feel great about sending you out and have a nice weekend.
Great, thank you. Thank you so much.
Bye.
Bye.
Hi, I've got your... Lucy, where's my patient in 440?
It's Lily, and she left 10 minutes ago.
Left? She didn't get her Floresta. I've got it right here.
She didn't sign a consent form.
I hope you know you're going to have to send it to her, because we need as many patients as we can get.
She didn't want the medication.
Did you say something to her? You said something. In my office. Now!
How dare you? How dare you do this? You know how important this drug is to this clinic? This company is everything. You're a guest here. What possessed you to think that you could meddle in this manner? Like, what are you doing? You're going to have to do 10 patients for this little mess up. Honestly.
Where's the patient autonomy? Where's the beneficence, the non-maleficence? We swore to take care of our patients. And that's not what we're doing here. I'm going to report you. You could lose your license. This isn't right.
Get out.
I will.
You will never work in dermatology.
Well, that went fairly well. Not perfect, of course, but no drug like this is going to get big without a few hiccups. But what's really important is that it works and that our clinic is in full support of getting this drug to every patient that needs it to change their lives. That's what's important.
Well, that went well.
I'm appalled at Dr. Foreman's rampant prescription of a drug that has not been shown to be effective in human subjects. It is not ethical to take money from a pharmaceutical company, not by any standards. I do want to succeed in derm, but not like this. I took an oath.
I mean, so.
No efficacy in human subjects. I just forgot what I was going to say.
It's offering Lunesta. Dang it. I think you want to say it's Lunesta.
Oh, shit. Okay, cut.
So apparently Floresta is a brand new medication taken once a day orally to clear your skin.
Wait.
Great, okay.
Oh, I mean, take it all out.